You might say that nurse Agnes Nambozo goes, quite literally, above and beyond, scaling a nearly 1,000-foot rickety wooden ladder to reach remote patients in the rugged mountains of eastern Uganda. Stationed in the rural Bulambuli district, she has, for over a decade, been a lifeline for communities perched on near inaccessible slopes. The main purpose of the perilous climb is to ensure children in remote communities receive life-saving vaccines. Many in these communities, she says, are reluctant to or cannot make the dangerous journey themselves.
Yeah, I don't have any issue climbing up here, but I also feel these people, they need our services like any other people need. That's why I always come and give them a service.
Nambozo also provides healthcare assessments for pregnant mothers, delivers medications to bedridden HIV and tuberculosis patients, and offers general medical care to families who would otherwise go without. Her efforts recently earned her a nod from Bill Gates in his latest Gates Notes. And her patients are also grateful for her efforts.
As she comes, she has helped us so much climbing this area, and we are now finishing immunizing our children.
According to Gates in his Gates Notes article, Uganda has reduced childhood mortality from 145 per every 1,000 live births in 2000 to fewer than 40 in 2023. He wrote that a lot of that progress can be attributed to vaccines and vaccinators like Agnes. But he also warned that her job has become more difficult, as many colleagues at her health clinic were supported by USAID and lost their jobs when funding was cut. Nambozo receives allowances from the government for travel, but she says it's often not enough to reach the villages. In addition, treacherous roads and frequent bad weather make the trips more difficult. But despite the challenges, Nambozo says she loves her job and that her daring climb to some of Uganda's most isolated people is just a part